Right, the recording is now started and I'm going to share my screen. Right, so my screen is shared and recording is in progress. So I welcome you all in today's lesson, and we will focus on how to prepare a training resource as a part of an assignment for the role within a local health and social care organization. So we are discussing about the Unit 4, Working in Health and Social Care. Working in Health and Social Care, which is for Level 3, and it is for ATHE, Level 3 Diploma in Health and Social Care. So, as you all know, that I'm Syed Mazharuddin Taj, and I'll be going to discuss the assignment brief with you. So, we have a task here. Uh, right. So, first of all, we will discuss about the assignment. So, as in the assignment brief, they have mentioned that there are fundamental essential principles that underpin the work of all health and social care practitioners, and it's vital that workers understand and know how to apply these aspects, which are key to service provision. For example, person-centered practice, effective communication, and safeguarding and protection. So in this study, we will uh, like um, develop and assess through a few of the um, points which are mentioned in the bullet points, like critical thinking, planning, organization, and time management, research, gathering information, note taking, and summarizing, then analysis, written skills, academic skills, including referencing, application of IT skills, and reflection. So, as I discussed earlier, this task is designed to assess your understanding of key principle, uh, and we will break down uh, and what you need to include in your training resources, along with explanation examples to help you create a comprehensive and compelling resource. So, first we will go through with the uh, definition of person-centered care. So here, as you can see, for the task one, they have mentioned that for this task, you are applying for a role within a local health and social care organization, and you are required to prepare a training resource for the interview, which includes the following. So when you are writing your assignment, you need to think like that you are applying for a role within a health and social care organization, and you are required to prepare a training resource. So when you are completing your assignment, specifically the task one, so you need to think like you are preparing a training resource for the interview, and that should include these bullet points: definition of person-centered care, and analysis of how person-centered ways of working contribute to continuity of care, and a description of the role of safeguarding and protection in person-centered practices, and an explanation of the benefits of positive risk taking for individual assessing services. And we have some extension activities with it as well. And if we want to gain a merit, then we must also analyze how the 6 C's of care underpin person-centered practice. And to gain a distinction, we also need to go for the analyze why it is important for health and social care workers to demonstrate person-centered values throughout their working practice. And in this task, we will cover the learning outcome 1, and it has 1.1, 1.2, 1.3, 1.4, and 1M1 and 1D1. So first of all, as they told us that we need to define person-centered practice. So what is person-centered practice? Person-centered practice is an approach to care that ensures that the individual receiving care is at the heart of all decisions and actions. So this approach respects the individual preferences, needs, and values, and encourages active participation in their own care. So this is the definition, and we need to um, include some key points like respect for individuality. Like each person is unique with their own preferences, values, and needs. Person-centered practice involves recognizing and respecting these differences. Then we need to consider for the collaboration. So care decisions are made collaboratively with the individual, ensuring that their voice is heard and respected. Then we have empowerment. So by focusing on the individual strength and preferences, person-centered practice empowers them to take an active role in their own care. So as an example, if we give an example as well, then that would be better in the assignment as well. So we can take example of a care setting. If an elderly individual prefers to have meals at a specific time, so a person-centered approach would ensure that their meal schedule is respected and adjusted to their preferences whenever possible. And why it is important? So understanding person-centered practice is crucial because it promotes dignity, respect, and autonomy, leading to better outcomes and a higher quality of life for those in care. Then the second point we need to discuss is an analysis of how person-centered ways of working contributes to continuity of care. So if we talk about continuity of care, so it refers to the consistent and seamless provision of care over time, ensuring that an individual health and social care needs are met without disruption. And person-centered ways of working are central to achieving this continuity. And there are a few of the key points to keep in mind, like consistent communication. So, a person-centered practice fosters open communication between care providers and the individual, ensuring that everyone is on the same page regarding the care plan. Then we have tailored care plans. So, by focusing on the individual specific needs and preferences, care plans are more likely to be followed consistently, even as different care providers become involved. Then we have the third point, reduced fragmentation. So person-centered approaches help bridge gap in care, ensuring that changes in care setting or providers do not disrupt the individual overall care. So as an example, when an individual transitioned from a hospital to a home care setting, a person-centered approach ensured that their care preferences and routines are maintained and reducing risk of confusion or stress. And why it is important? So ensuring continuity of care through a person-centered approach improves the individual experience and outcome, leading to more effective and sustainable care delivery. And the third point is a description of the role of safeguarding and protection in person-centered practice. So if we talk about safeguarding, so safeguarding involves protecting individuals, especially vulnerable groups, from abuse, harm, and neglect in a person-centered practice. Safeguarding is a key component, ensuring that the individual well-being is prioritized in all aspects of care. So there are again some key points to consider, like protection from harm. Person-centered practice include proactive measures to protect individual from physical, emotional, and financial harm. Then we have empowerment through safety. So safeguarding empowers individual by creating a safe environment where they can express their needs and preferences without fear. Then we have the legal and ethical responsibility. So care providers have a legal and ethical obligation to safeguard individual, ensuring that their rights are respected and upheld. So, as an example, if a care provider notices sign of potential abuse, a person-centered approach would involve immediately uh, reporting the concern and ensuring that the individual is protected while the situation is investigated. So why is this important? Safeguarding is fundamental to person-centered practice because it ensures that individuals are not only respected and heard, but also protected from harm, which is essential for their overall well-being. Then the fourth bullet point is an explanation of the benefits of positive risk-taking for individual assessing services. Right. So when we talk about positive risk taking, so it's about empowering individual to make choices that involve some level of risk, recognizing that taking risk can lead to potential growth or personal growth, increase independence, and improve quality of life. So again, few of the key points to consider are a balance of risk and autonomy. So positive risk taking involves finding a balance between protecting individuals from harm and respecting their right to make their own choices. Then we have promoting independence. So it's allowing individual to take risks, help them build confidence and independence, which are important aspect of person-centered care. Then we have enhancing well-being. So engaging in activities that involve risk, such as trying a new hobby or managing their own medication, um, it can lead to greater satisfaction and well-being. So as an example, encouraging a person with mobility challenges to use a walking aid instead of wheelchair may involve some risk of falls, but it can also increase their independence and mobility over time. So why is this important? Positive risk-taking supports the principles of person-centered care by empowering individuals to take control of their lives, make their own decisions, and pursue activities that bring them joy and fulfillment. So, uh, um, if we understand and apply these conditions, so person-centered practice, continuity of care, safeguarding, and positive risk-taking, we will be prepared to contribute to a health and social care environment that prioritizes the dignity, safety, and well-being of individual. And as you create your training resource, remember to provide clear definition, thoughtful analysis, and relevant example to demonstrate your understanding of these essential principles. So, and also we need to keep in mind that these principles are not just theoretical, they are practical tools that when applied correctly can improve the quality of care provided to individuals. Then we have uh, the task 2, and also for extension activities we have to analyze how the 6 C's of care underpin person-centered practice. And for distinction, we need to analyze why it is important for health and social care workers to demonstrate person-centered values throughout their working practice. So I'll encourage all of you to go for the merit and distinction as well. Uh, like when we are going to attempt for the merit or distinction, so how we will go, like I have told you earlier before in your previous assignments, first we will go for the P criteria, then the merit criteria, then the distinction criteria. So they all will be in sequence. For example, in this one, when we are uh, doing the task one, so first we will do the 1.1, then we will go for 1.2, then we'll go for the activity 1.3, then 1.4. So these all are the pass criteria. Then we'll go for merit 1M1, and for distinction we'll go for 1D1. So we will go in sequence 1.1, 1.2, 1.3, 1.4, 1M1 and 1D1. So don't think that if you only do the 1D1, which is the distinction criteria, and you will think that, okay, I have done the assignment on the basis of the distinction criteria, so I'll get distinction. No, it's not correct. You have to go in sequence. First, you'll go for the pass criteria. So in this case, we have 4 pass criteria to achieve, which are these 1.1, 1.2, 1.3, and 1.4. When we'll do that in sequence, after that, we will go for the 1M1, then we'll go for 1D1. So make sure that you all do in the sequence, write in the sequence for all those assignment. Specifically for example, we are talking about the task one. So you have to go in sequence and attempt the passing criteria, and you must have to pass in the passing criteria. And no matter if you have written about the merit or distinction criteria, if you don't pass in the main passing criteria, then you won't be able to get a successful grade in the task one. So we must have to pass the passing criteria of learning outcome 1, 1.2, 1.2, 1.3, 1.4. Then we'll go for merit and distinction. So now if we talk about the task 2 of your assignment, so in task 2 we are going to focus on the vital role of communication in health and social care settings. So communication is the cornerstone of effective care, as it ensures that the needs and preferences of individual are understood and met. In this task, you will be analyzing various aspects of communication, from methods used to the challenges faced and the importance of confidentiality. So if we break down each part of this task and explore how you can approach it. So we need to describe the role of communication in health and social care. Again, we have 1, 2, 3, 4, 5. These 5 bullet points to discuss and write in your assignment. And then we have a merit criteria and distinction criteria as well. So if we talk about communication, so communication is the process of exchanging information, ideas, and feelings between people. So in health and social care, effective communication is crucial because it helps build relationship, ensures the delivery of person-centered care, and facilitate the coordination of services. Then we have a few of the important points, like building trust and rapport. So effective communication help establish trust between care providers and individual. For example, when a care worker listens actively to an individual concern, it fosters a sense of trust and respect, which is essential for delivering high quality care. Then we have ensuring accurate information sharing. So, communication ensures that all team members are informed about the individual care plan, preferences, and any changes in their condition. So, this is important for continuity of care and for avoiding errors. Then we have supporting emotional well being. So, communication is not just about exchanging information, it's also about providing emotional support. For example, comforting words from a care worker can like positively impact an individual emotional well-being. So, for example, um, whenever we see a um, service user and we ask them politely about how was their day, and if we have a smile on our face and if we are providing comforting words, so then it could impact the service user's emotional and like positively, and it would enhance the emotional well-being. So, why it is important? So, if we understand the role of communication in health and social care, so is essential because it impacts every aspect of care delivery. It ensures that individuals receive the care they need in a way that respects their dignity and preferences. So, next we have uh, explain methods of communication used in health and social care. So, in health and social care setting, communication can take many forms depending on the context and the needs of the individual involved. We have verbal communication. So, this is the most common method and includes face-to-face conversation, telephone calls, and video conferencing. It's effective for conveying information clearly and directly. Then we have non-verbal communication. So it involves body language, facial expression, and gestures are all forms of non-verbal communication that can convey empathy, understanding, and reassurance. For example, a smile or a nod can show that you are listening and understand what the individual is saying. Then we have written communication. So this includes care plans, medical records, email, and reports. Written communication is crucial for documenting care and ensuring that there is a clear record of the services provided. Then we have visual tools like pictures, symbols, sign language, and these can be used. So, especially with individuals who have hearing impairments or cognitive difficulties, for example, using pictograms can help individuals with dementia understand their care routines. Then we have assistive technology. So tools such as hearing aids, speech generating devices, and communication apps are increasingly used to support individuals with communication difficulties. So why it is important? So um, knowing the different methods of communication help you tailor your approach to meet the needs of each individual, ensuring that communication is effective and inclusive. Then we have to discuss about the identify barriers to communication in health and social care. So, despite the importance of communication, there are several barriers that can hinder effective communication in health and social care setting. Like we have language differences. So individuals from different cultural background may speak different languages, making it difficult to communicate effectively. For example, a non English speaking individual may struggle to understand their care plan without an interpreter. Then we have sensory impairments. Hearing loss or vision impairment can make it difficult for individual to receive or convey information. For instance, an individual with hearing loss may not hear important instructions unless they are provided with hearing aids or alternative communication methods. Then we have cognitive impairments. So conditions such as dementia or learning disabilities can affect an individual's ability to understand and process information, making communication more challenging. Then we have emotional distress. So anxiety, fear, or depression can also be barriers to communication. An individual who is emotionally distressed may not be able to focus on or understand what is being communicated. Then we have environmental factors like noise, poor lighting, and lack of privacy can also hinder communication. As an example, a busy, noisy environment might make it difficult for an individual to hear or concentrate on a conversation. Then, why all of this is important? Identifying barriers to communication allows you to address them proactively, ensuring that communication remain effective and that the individual needs are met. Then we need to discuss about the fourth bullet point, which is describe information handling and recording procedures. So proper handling and recording of information are critical in health and social care setting to ensure that they are accurate, up-to-date information is available to all relevant parties. If we talk about documentation, accurate documentation of care plan, progress note, and incident report is essential. So these records must be kept up to date and reflect the current status of the individual health and care needs. Then we have confidentiality. So information must be handled in a way that protects the individual privacy. This includes storing records securely and only sharing information with those who have a legitimate need to know. Then we have data protection. Compliance with data protection laws such as GDPR is essential, and we also have the Data Protection Act. These involve ensuring that personal data is stored securely, used appropriately, and not disclosed without consent. Then we have electronic records. So many health and social care settings use electronic health record to store and manage information. These systems help ensure that information is easily accessible to authorized personnel while maintaining security. And again, why all of these are important. So proper information handling and recording are essential for providing safe and effective care, ensuring that all care providers have the information they need to deliver person-centered care. Then we have explain the principles of practices relating to confidentiality in health and social care. So confidentiality is a core principle in health and social care, protecting the privacy and dignity of individual. So first we have respecting privacy. So confidentiality ensures that personal information about an individual health and care is kept private and only shared with those who need to know. Then we have building trust. So individuals are more likely to share important information with care provider if they trust that their information will be kept confidential, and this is crucial for effective care planning and delivery. Then we have legal and ethical obligation. Health and social care workers are legally required to maintain confidentiality with strict penalties for breaches. Ethical guidelines also emphasizes the importance of confidentiality in maintaining professional integrity. Then we have exceptions to confidentiality. So we have some situation where confidentiality may need to be breached, such as when there is a risk of harm to the individual or others. In cases, the decision to breach confidentiality should be carefully considered and documented. Why all of this is important? So, understanding the principles and practices of confidentiality is essential for maintaining trust, complying with legal requirements, and ensuring that individuals feel safe and respected in their care. Then we have the extension activities. So, for higher grades, you will need to deliver deeper into the topics. Like for merit grade, we need to analyze factors that can influence the maintenance of confidentiality. So this might include discussing how organizational culture, staff training, and technology can impact confidentiality practices. And for distinction grade, you need to evaluate strategies used to overcome communication barriers in health and social care setting. You can consider with adding the specific examples such as the use of interpreters, assistive technology, or environmental adjustment, and discuss how effective these strategies are in practice. So in task 2, you will be exploring the vital role of communication in health and social care. By understanding the methods of communication, identifying barriers, and mastering information handling and confidentiality, you will be well equipped to provide high quality care that respects and meet the needs of individual. Again, we need to keep in mind that effective communication is not just about exchanging information, it's about understanding and being understood, ensuring that every individual receives the best possible care in a way that respects their dignity and autonomy. Then again, we have to go in sequence for all the learning outcome. So for learning outcome 2, we have the activities 2.1 and 2.2, 2.3, 2.4, 2.5. So first you will, after you finish your 1D1, then you'll go for 2.1, 2.2, 2.3, 2.4, 2.5. Then you will attempt the merit criteria, and then you will attempt the distinction criteria. So this would be the sequence. Then we have to, then we have to focus on creating a training guide for new staff in health and social care, specifically on the topic of infection prevention and control. This is crucial aspect of care as infection can have severe consequences, especially for vulnerable adults. So let's break down the key components of the training guide. Right. So we have the first bullet point, explain the cause and spread of infection. So understanding the cause and spread of infection is the first step in preventing it. Infections are caused by pathogens, which include bacteria, viruses, fungi, and parasites. So these pathogens can enter the body through various routes, such as through the respiratory tract, digestive system, or breaks in the skin. So common causes of these infection are bacteria such as E. coli, and they can cause infection like pneumonia, urinary tract infection, and wound infection as well. Then we have viruses such as the influenza virus and coronavirus can cause respiratory infection and other uh, systemic condition. Then we have fungi, so such as candida, which can cause infection in compromised individual. Uh, then we have parasites. We can say Giardia, which can cause gastrointestinal infection. And then we discuss about the spread of infection. Like we have direct contact. So this occurs when pathogens are spread from one person to another through physical contact, such as touching or kissing, for example. MRSA can spread through skin to skin contact. Then we have indirect contact as well. So pathogen can spread by uh, contaminated objects or surfaces. For example, um we can take example of a doorknob that has been contaminated by an infected person, and then touching your face can spread infection. Then we have droplet transmission. So when an infected person cough or sneeze, they release droplet that contain pathogens, which can be inhaled by others nearby. Then we have airborne transmission. So some infections like TB can spread through tiny airborne droplets that remain suspended in the air and can be inhaled over distances. So again, why all of these are important? So understanding how infection is spread, help in developing strategies to interrupt the transmission of pathogens, thereby preventing outbreaks. Then we have to explain the importance of preventing and controlling the spread of infection. So infection prevention and control is essential to protect both individual receiving care and healthcare providers. Um then we have infection in healthcare setting can lead to serious, sometimes life-threatening complications, particularly for those with weakened immune system. We can discuss about protecting vulnerable population. Uh, we can say individual in health and social care setting have compromised health, making them more um like attractive to infection. Preventing the spread of infection is crucial for protecting these individuals from further harm. Then we have reducing healthcare cost. So infection can lead to prolonged hospital stays, additional treatment, and even legal implication. So all of which increase healthcare cost. Effective communication control measure help reduce these costs. Then we can discuss about maintaining trust and safety. So a healthcare setting that effectively control infection, maintain within the trust of patient and their families, and it ensures that the environment is seen and uh, we can say it's safe and reliable as well. So the safety and well-being of everyone in healthcare setting depends on effective infection control measure. It's not just about preventing illnesses, but also maintaining a safe and trusting environment. Then we have to discuss about explain how to reduce the spread of infection. So reducing the spread of infection involve implementing a range of practices that minimize the risk of transmission. We have hand hygiene, so regular and thorough hand washing with soap and water or using an alcohol-based hand sanitizer is one of the most effective ways to prevent the spread of infection. Then we have use of personal protective equipment, PPE. So wearing gloves, masks, gowns, and other protective gear help prevent the spread of pathogen, especially in high-risk situation. Then we have cleaning and disinfection as well. So regular cleaning and disinfection of surfaces, equipment, and areas that are frequently touched help reduce the spread of pathogen. Then we have isolation procedure. So in some cases, isolating infected individual from others can prevent the spread of highly contagious infection. Then we have vaccination. So encouraging vaccination among staff and individual receiving care help prevent the spread of vaccine preventable disease. As we all have experienced this during the COVID pandemic, and these measures are crucial in breaking the chain of infection. So, by applying these practices, healthcare providers can protect themselves and those in their care. So, again, for merit grade, you need to analyze how an outbreak of infection would be managed. So, in a health and social care setting, we need to consider how the infection would be identified, how communication and isolation would be handled, and what step would be taken to contain and eliminate the infection. And for distinction grade, you must assess how risk assessment can contribute to reducing the spread of infection. So this involves evaluating how and identifying risks such as potential sources of infection can lead to targeted measures and that can prevent the outbreak. So in this task, you will be preparing a guide that equips new staff with the knowledge they need to prevent and control infection effectively. So by understanding how infection is spread, the importance of prevention, and the specific measure that can reduce transmission, staff can create a safer environment for everyone. And we need to keep in mind that infection control is a shared responsibility, and by implementing these practices you can help protect not only the individual in your care but also your colleagues and the broader community. Then we have the task 5. uh, we have right. So in the task 5, we need to discuss these bullet points, and you need to prepare a leaflet, short information leaflet. So I believe that you all are familiar with what is a leaflet looks like. So we have those at our home, and we need to prepare a leaflet, and in that we need to include these information, these 3 bullet points. Like we need to explain the purpose of care planning. So if we discuss about care planning, so care planning serves several critical purposes in health and social care. For example, personalized care. So care plans are designed to meet the specific needs, preferences, and goals of each individual. This personalized approach ensures that care is tailored to what is important to the person receiving it. Then we have consistency in care delivery. So by documenting all aspects of an individual care plan provide a clear guideline for all care provider, ensuring that the care delivered is consistent and continuous, even as different staff member become involved. Then we have communication. So care plan facilitate effective communication between the individual, their family, and the care team. So they ensure that everyone involved in the individual care has access to the same information and is working toward the same goals. Then we have monitoring and evaluation. So care plan are used to monitor the individual progress and evaluate the effectiveness of the care being provided. So they provide a basis for regular reviews and adjustment to the care plan as the individual need change. So the purpose of care planning is to ensure that each individual receives the best possible care in a structured, organized, and person-centered manner. It's about making sure that care is not only appropriate but also effective and responsive to the individual changing needs. Then we have outline roles and responsibilities involved in the care planning processes. So, care planning is a collaborative process that involves multiple roles and responsibilities. Each participant in the care planning process plays a crucial part in ensuring that the plan is comprehensive and effective. So, first we have the individual. So, the person receiving care is at the center of the care planning process. Their preferences, needs, and goals should be guided, and it should be in all the decisions, and they should be actively involved in every stage from planning to review. Then we have care workers. So care workers provide direct care and are responsible for implementing the care plan on a day-to-day basis. They also observe and report any changes in the individual condition that may require adjustment to the care plan. Then we have nurses and medical staff. So these professionals contribute their medical expertise to the care plan, ensuring that it addresses the individual health need effectively. And they may also carry out specific intervention outlined in the care plan. Then they have family members and advocates. Family members and advocates can provide valuable insight into the individual preferences and history. They also support the individual in expressing their wishes and uh, making informed decision. Then we have care managers. So care manager oversee the entire process, ensuring that the care plan is comprehensive, up to date, and implemented effectively. They coordinate between the various team members and manage the review process. So all of these are important because understanding the role and responsibility in care planning is crucial for ensuring that every aspect of an individual care is considered and that the care plan is implemented effectively. It also ensures that everyone involved knows their role and how they contribute to the overall care process. Then we have describe how to ensure the individual is involved in all stages of care planning and review. So, involving the individual in every stage of care planning and review is fundamental to person centered care, and how you can ensure that the um, uh, how can we ensure that their active participation is there. So we have active listening. So we need to engage the individual in conversation about their preferences, goal, and concern, and we need to ensure they feel heard and valued. For example, we can ask open-ended question about what is important to them in their care. Then we have providing information. So we offer clear and accessible information about the care planning process, including the option available to them, and this will empower the individual to make informed decision about their care. Then we have encouraging participation. So involve the individual in setting goals and making decision about their care. This could include choosing daily routine, types of activities, or preferred treatments. Then we have regular reviews. So we can schedule regular reviews of the care plan with the individual to assess progress and make necessary adjustment. And we can encourage them to share feedback on what is working well and what might need to change. Then we have respecting autonomy. So we need to ensure that the individual choices are respected, even if they differ from the options of care provider or family member. This is essential for maintaining their autonomy and dignity. So overall, the individual's involvement in the care plan ensure that the care they receive truly respect their uh, needs and preferences. It also promotes a sense of ownership and control over their care, which can improve their overall satisfaction and well-being. Then again, we have the extension activities. So we need to explore the topic more deeply. For merit grade, we have to analyze ways to overcome barriers to implementing care plan. You need to consider challenges such as communication difficulties, cultural difficulties, uh, and also cultural differences or resistance to change. So you can discuss strategies to address these barriers, such as using interpreters, cultural competence training, or engaging in motivational interviewing. Then for distinction grade, uh, you need to critically review the challenges of developing care plan that meet the needs of individual and their agreed outcome. So you need to evaluate issues such as balancing different priorities, for example, medical need versus personal preferences. Then we have limited resources or complex cases where multiple conditions must be managed. And these are the important aspects. Then for the learning outcome and assessment criteria, again, we have the learning outcome 5, and the activities are after finishing the 4M1, you will go for the 5.1, then 5.2, 5.3, then 5M1 and 5D1. Right. Then for the task 6, as you all know that in this unit we have uh, 6 learning outcomes to cover, and that's why we have 6 tasks to complete in this unit. So now if we discuss about the task 6, so it's about safe administration of medication. uh, so you will focus on the safe administration of medication, which is another key responsibility in health and social care, and reflecting on your experiences or conduct research to cover the following points. So first we have, we can say, common types of medication and their effects. Uh, so you can explore various medications such as pain relievers, antibiotics, and antidepressant, discussing their intended effect and potential side effect as well. Then you can discuss about the uh, different routes. Okay, so we need to describe common types of medication and their effects and the potential side effects. Then we have different routes of administration. So in the second bullet point, we need to um, explain how medication can be administered, orally, topically, uh, and different forms, and why different routes are chosen for different situation. Then we have to discuss about safe administration practices. So we need to describe how to administer medication safely and in line with current legislation and guideline. So we need to discuss how to administer medication safely, including checking prescription, adhering to the 7 rights of medication administration, and monitoring for adverse reaction. And also we need to give example of legislation and guidelines. Then we have to explain the record to be completed for the storage, administration, and disposal of medication. So we need to explain the importance of accurate record for the storage, administration, and disposal of medication. And we need to also write about like we need to ensure compliance with legal and organizational requirements are also there. And yes, so these all are the important aspects. Then we have for extension activities, we have a distinction criteria here. We don't have a merit criteria in this task. We have a distinction criteria. So we need to analyze a standard precaution for infection control during medication administration. We can discuss the importance of hand hygiene, um, uh, personal protective equipment, and environmental cleanliness in preventing the spread of infection. So again, then for the learning outcome and the assessment criteria, we have in this one, after we finish the 5D1, we will go for the 6.1, 6.2, 6.3, 6.4, and in the last for 6D1, the distinction criteria. So throughout this unit, we have highlighted the importance of professionalism, ethical practice, and continuous learning in health and social care. So the principles and the practices discussed are not just theoretical, they are practical tools that, when applied correctly, can enhance the quality of care provided. So if anyone of you have any question, then please don't hesitate to ask. I'll try my best to answer your questions. If you have any question, then please do ask. And also, you need to remember that like you need to do the referencing and in-text citation, and we are using the Harvard referencing style. So make sure that you use correct referencing style in your assignment for both the references and the in-text citation. And also like there would be a suitable font size and style. So for example, you can use the Arial uh, font, and also you can use the font size of 12 plus for the space between the line you can use 1.5 spacing. And make sure that it's not like necessary that you create a table of content, but it's a good practice if you include a table of content in your assignment. So the first page would be the assignment title, or the page provided by the college for maybe it has the declaration as well. So you need to include that in your first page, all the information regarding your uh, student number and the unit name and specification like these, and maybe it has the declaration. Then you will have the uh, table of content, and after that you will start your assignment. And you need to make sure that there are in-text citation and references at the end, and these should be in Harvard referencing style. And if you'll use the font of Arial and size 12, and the line spacing would be 1.5, so it would be better. And what else? Also, like we add the introduction in the start for the overall assignment, not only for each activity. The introduction part is not for each activity. It's for the whole assignment in the beginning, and in the end we will do the conclusion of all the 6 tasks. We don't need to do the conclusion for each individual task. So for example, when we start from the task 1, which is we have learning outcome 1.1. So before we start the learning outcome 1, for the introduction, we will give the overall introduction of the unit 4, which is working in health and social care. So in that introduction, you will include all the information related with the task 1, task 2, task 3, task 4, and task 5, also task 6. Then when we have completed, then you will start after the introduction, you will start with the learning outcome 1, which is 1.1. Then you'll go for 1.2, 1.3, 1.4, then the 1M1 and 1D1. Then you will go for the learning outcome 2, which is you need to do the 2.1, 2.2, 2.3, 2.4, 2.5, and 2M1 and 2D1. Then you will go for the task 3, which is the assessment criteria 3.1, 3.2, 3.3, 3 merit 1, and 3 distinction 1. Then you will go for the learning outcome 4 and the assessment criteria 4.1, 4.2, 4.3, 4.4, and the 4M1. Then you will go for the task 5, and in that you will cover the learning outcome 5 and the assessment criteria 5.1, 5.2, 5.3, and 5M1 and 5D1. Then you will go for the task 6, and in the learning outcome 6 you will go for the assessment criteria 6.1, 6.2, 6.3, 6.4, and 6D1. After you complete your 6D1, then you will write your overall conclusion, and the conclusion would be for all of the tasks. It's not only for the task 6. And after the conclusion, you will have the reference list in Harvard style, and there would be in-text citation between your content, and make sure it also in Harvard referencing style. So these all are the important aspects regarding your assignment. And if you do have any question, then please do ask. Any question from anyone? No questions. So if no one has any question, then I wish you all the best for your assignment. And in the meanwhile, if you do have any question, then please don't hesitate to contact the management and drop in your question, and we will try our best to answer those. And again, best of luck to everyone, and do submit the assignment on time. And that's it for today. So take care, everyone. We'll meet with the next assignment. Thank
Have we
you.
got a lesson tomorrow? Or no lesson tomorrow?
No lesson tomorrow.
Okay, and hand it in 2 weeks.
Yes, you have 2 weeks time period to.
Okay, thank you.
Thank you, Jessie. Thank you. Take care.
Bye-bye.
Bye.